Hi folks, I'm Dr. Ed Beyer. Today we're going to continue our discussion on the 22 causes of low thyroid. Very important, folks. I get tons of people coming to see me that are very frustrated with their whole thyroid situation, and it's plain and simple. There are many, many ways that the thyroid can go wrong that traditional medicine and your endocrinologist doesn't look at. And that's very important. And today we're going to go over the number one cause of the 22. This is the most prevalent. And I want to remind you that most of the people who have low thyroid have multiple reasons, not just one, but multiple reasons. But this is the number one cause of low thyroid in the United States, and it's an autoimmune disease called Hashimoto's thyroiditis or low thyroid. This is a condition where the immune system is forming antibodies and it's attacking an enzyme in the gland called thyroid peroxidase. So low thyroid due to thyroid peroxidase antibodies, or TPO, which is thyroid peroxidase. It's an autoimmune disease, the immune system attacking that enzyme in our gland, and now the thyroid won't work right. So TPO is an enzyme in the thyroid gland responsible for the production of thyroid hormones. A positive TPO antibody test suggests Hashimoto's disease. Hashimoto's was a Japanese surgeon back in 1912 who discovered this. That's the name of the disease. This is an autoimmune disease, folks. This is not a problem in the thyroid directly. It's a problem in your immune system causing antibodies or attacking the thyroid. Proper testing is key. Many, many patients come to me and don't even know they have this. About 70% of people with low thyroid, this is one of the reasons why they have it and they're unaware of it. And so proper testing is key. Traditional medical care versus functional medical care, which is what we practice in our clinic, functional medicine. We want to know why behind everything. The why is really important to us in the management of autoimmune thyroid. Now, traditional medicine many times doesn't even know, their endocrinologist or the general practitioner doesn't even know that this is going on unless they run the antibody test, which it doesn't really matter to them because they're still going to look at your TSH and T4 and adjust whatever medication, Synthroid, levothyroxine, or whatever you're on. Whereas from a functional medicine perspective, we want to know why would your immune system, why would the immune system be attacking this very important enzyme in your thyroid? And in the scientific literature, there are reasons why this is happening. And, you know, clinical experience, me doing this for 29 years, there's thousands of reasons why your immune system, someone's immune system would be doing this. We identify those reasons and remove them, and we put the autoimmune disease in remission. So I'm interested in identifying and removing all the autoimmune triggers and balancing and strengthening the immune system. This is a very complex subject on how this is done. I do have a video all on the autoimmune process. This, by the way, is the number one autoimmune disease in the United States, so it's very, very common and often underdiagnosed. Now, what are the common autoimmune triggers to Hashimoto's disease? Why would someone's immune system form antibodies to that important enzyme in the gland? An inflammatory diet. Boy, I tell you, the standard American diet is super inflammatory. My nutritionist, Alexa, goes through all this with all of our patients and explains these foods create inflammation, these foods do not, and you'd be shocked at what does. Blood sugar problems. If our insulin, which is a hormone that controls our blood sugar, or cortisol, another hormone that controls blood sugar, if those are too high or too low, those will create inflammation. They can be very inflammatory. Food sensitivities. Folks, the food we eat now is not the same food we ate 20, 30, 40 years ago. It's been genetically modified. And so a lot of our immune systems aren't recognizing it. And when we eat it, it sets off a cascade of inflammation and immune dysfunction to the point that our body will start to form antibodies against our own tissue, especially thyroid. There's a strong correlation between gluten sensitivity and Hashimoto's autoimmune thyroid and other things. Leaky gut syndrome. This is where the permeability of the gut is too much and things start to leak their way from the small intestine into the bloodstream and the immune system reacts to it. We test for this. It's crucial. People with autoimmune disease all have leaky gut, all have food sensitivities, they have all these reasons, and once we identify them and remove them, you're able to put the autoimmune process into remission. So this is all in the scientific literature. A lot of information on leaky gut being the gateway to immune dysfunction. Chronic infections, viral infections, gut infections. I cannot remember an autoimmune patient, a Hashimoto's patient, that did not have a gut infection. Lyme disease is also another one that's more common than you think. Adrenal dysfunction and other hormone imbalances like progesterone, estrogen ratios in females, I see a lot of that create immune dysfunction and can be a trigger to autoimmune thyroid. Also, some other things that will trigger from a nutritional point of view, low vitamin A, low vitamin D, low essential fatty acids, and low glutathione. These are molecules, things that we need to get from our diet. Glutathione is something that we make in our bodies, so is vitamin D. And these are all immune modulators, so if someone's deficient in these, the immune system isn't going to be healthy, and one of the mistakes the immune system can make is to form antibodies against the thyroid. So we have to look at this. Now, just an aside, a large percentage of people who have Hashimoto's, who have antibodies against their thyroid, over half of them have antibodies to an area of the brain called the cerebellum. And these people will have like vertigo, migraines, dizziness, balance disorders, chronic neck and back pain, clumsiness, tremors, things of that nature. So there's a strong correlation between autoimmunity against the thyroid and autoimmunity against brain tissue. I'm Dr. Ed Beyer. I hope that helps. Have a great day.